Calcifications developing in the breast and detected on screening mammograms are variable in number and appearance, and most reflect a benign etiology. Here are examples of breast calcifications with illustrative images showing benign and malignant calcifications. First, the skin calcifications. As we can see here, multiple groups of round and oval lucent-centered calcifications. This is considered BIRADS 2 and considered benign finding. Another example of skin calcifications here seen on cleavage view. Many round and oval lucent-centered calcifications are noted posteromedial seemingly in the breast with typical skin benign calcifications. Arterial calcifications. A. Medial-lateral oblique views in a 63-year-old woman. The lateral thoracic arteries and some branches of the internal mammary arteries, illustrated by arrows, are densely calcified bilaterally. B. Medial-lateral oblique views, 2 years after those in Part A. Arterial calcifications are almost completely resolved after treating the underlying cause. Vascular calcifications considered benign as well. BIRADS 2. Also one of the benign calcifications, what's called rod-like calcifications, forming in subsegmental ducts and images here. These calcifications are dense, rod-like, and linearly oriented toward the nipple. They are often identified bilaterally, usually with no round, punctate, or amorphous forms in the neighborhood, and classified as BIRADS 2, a benign finding. Round and punctate calcifications. As we can see here, this group of calcifications is characterized by relatively monomorphic round and punctate calcifications having some variation in density. No linear forms or linear orientation is seen. BIRADS 2. Benign finding. Stromal dystrophic calcifications are dense, coarse calcifications developing in fibrous tissue and not a predefined space, are variable in size, density, and shape. They may be focal, limited to areas of prior surgery or trauma, or diffuse, and they belong to the benign entity. Another type of benign calcifications is the popcorn type. As we can see, the faint coarse calcifications are present in the upper outer breast, illustrated by arrow. Follow-up mammogram was performed 3 years after showing the calcifications arrow have enlarged and are now characteristic of an involuting fibroadenoma. Malignant calcifications. Linear calcifications COMSDR the most common form. They are seen arranged in a linear distribution. In this case of ductal carcinoma in situ at image A, a group of calcifications that includes linear calcifications in a linear ductal distribution as well as coarse, dense heterogeneous calcifications. Note that the density of the calcifications is variable. BIRADS for C, suspicious abnormality. Biopsy was indicated and revealed ductal carcinoma. At image B, spot compression magnification view. Group of calcifications that includes linear calcifications in a linear distribution as well as coarse heterogeneous calcifications. Note the irregular margins of the linear calcifications. This type is classified as BIRADS. 4C. Suspicious abnormality. Biopsy was indicated. Another example of linear calcifications in a linear ductal orientation suspecting ductal carcinoma. In image A, spot compression magnification view. Dense linear calcifications in a linear ductal distribution. BIRADS for C. Suspicious abnormality. Biopsy was indicated. In image B, linear calcifications with irregular margins and clefts in a linear, branching distribution. These calcifications develop an intraluminal necrotic debris, reflective of the ongoing proliferative cellular process. Fine pleomorphic calcifications are also present. BIRADS for C.